looking at the screen, what do these three people have in common?
Is that John Mellencamp?
That is John Mellencamp.
And who's the guy in the
That's
right?
Hank Williams Sr.
I was going to guess
And
that.
this is Olivia Derus, my daughter. Does anybody
Well,
know?
I'm guessing she's not a crooner, so it's not that.
No.
But other than that,
All three of these people have a neurotube defect called spina bifida. This is a congenital defect of the spine, which is part of the spinal cord that reaches meninges and are exposed through a gap in the back. Spina bifida is the most common neurotube defect with people who are born within babies. An estimated 166,000 individuals live daily with spina bifida. There are, I don't know why it's dark. There are three types of spina bifida. We have occulta, which is the mildest form of spina bifida. Most time a baby is born and they will have an abnormal tuft of hair, a collection of a fat pad, or a small dimple and birthmark on the back right by the spine, which is an indication that a child has a spinal deformation. Most people don't even know that they have it unless it's caught for another test, which could be a CT scan or an X-ray for another unknown reason. The second type of spina bifida is a meningocele. A meningocele is a protective membrane that is covered around the spinal cord and pushes out through the vertebrae. So you still have your spinal cord, and then you have your break, and so there's like a little bit of a bubble. I'll kind of show it right here. So you have the occult, which is broken through, and then the meningocele, which is actually a sac. It's a little bit further through. The membranes can be removed by surgery with little or no effect to the nerve because the nerves aren't out of the spinal column. The most severe form is the myelomeningocele. A baby's spinal cord remains open along the nerve where the nerve endings actually come out. Sometimes there is not a covering over the spinal cord, and this is out at birth. Something to understand is when you have a myelomeningocele, when you're born, having the nerves exposed can damage the spinal cord. Having this at birth, you are able to get infections that can actually, can kill you. Usually the tissues and nerves are exposed. Some of the impairments for myelomeningocele are muscle weakness in the legs, bowel and bladder issues. You can also have orthopedic problems with the deformed feet, uneven hips, and curved spine, which is scoliosis. Diagnosis for spina bifida is you can have an amniocentesis, an AFP test, which is the alpha fetoprotein, which is a blood test, and an ultrasound that you get while you're pregnant. After birth, if you have the rare form, CT scans and MRIs are the way you can diagnose. Risk factors deal with race. Caucasian and Hispanics are more it affects that race more. Female girls are at higher risk. Also, families that have a neurotube defect within their family are more privy to getting this. They talk about having folic acid, which is the vitamin B9 deficiency, diabetes, and obesity. Coping and living with spina bifida have a couple different things. You can have a mental learning deficiency. As the older you get, learning to take care of yourself and your healthcare needs. Finding a job, you know, if you do have the myelomeningocele, most often you are wheelchair bound. Living on their own and developing relationships are all things that people who live with spina bifida have to deal with daily. Even though we have all of these things and, you know, it doesn't look like it's a, they have a lot of roadblocks in the way to becoming a successful individual, and with support of family and medical support and going to the right doctors, they can end up living a very successful life. And here you can see my daughter, she does have braces. She also does have a wheelchair, but they're very brave individuals. And so having all of these in place, you can end up living a very successful life. Any questions?
Which type does your daughter have?
She has the myelomeningocele. So when she was born, her nerve endings were out of the back, and so within 24 hours, she had back surgery to close it, and then she had a shunt put in, because down your spinal column is cerebral spinal fluid that kind of goes down your, through your brain, down your spine, and back up. When there's a break, it just empties out into the stomach. So they place something called the shunt in, and it actually takes the spinal fluid down and then to the belly.